What causes debilitating pelvic pain in interstitial cystitis? Imagine living with a constant ache in your lower abdomen or pelvis that worsens as your bladder fills and eases only briefly after urination. That's the reality for many people with interstitial cystitis, also called bladder pain syndrome. While the exact cause of this condition remains a mystery, scientists have identified several factors that likely contribute to the intense pelvic pain experienced. One leading idea is that the protective lining of the bladder, called the urothelium, becomes damaged or defective. Normally, this lining acts as a barrier, preventing irritating substances in urine from reaching the deeper layers of the bladder wall. When this barrier is compromised, urine components like acids and enzymes can irritate the bladder tissue, leading to inflammation and nerve activation. This inflammation can cause the persistent pain and urgency that characterize interstitial cystitis. Another important factor involves immune cells called mast cells. These cells are part of the body's immune response and are found in the bladder wall. In people with interstitial cystitis, mast cells may become overly active, releasing chemicals that promote inflammation and sensitize nerves. This heightened nerve sensitivity can make even normal bladder filling feel painful and increase the urgency to urinate. Some researchers also believe that abnormal functioning of the pelvic floor muscles or nerves may play a role. Tight or spasming pelvic muscles can put pressure on the bladder and nerves, intensifying pain. There's also speculation about autoimmune responses, where the body's immune system mistakenly attacks its own bladder tissue, causing ongoing inflammation and discomfort. However, these theories are still being studied, and no single cause has been definitively identified. Symptoms of interstitial cystitis include persistent pelvic pain, a frequent and urgent need to urinate, and discomfort that can fluctuate throughout the day. Triggers such as sexual activity, menstruation, stress, or certain foods and drinks can worsen symptoms. Importantly, these symptoms occur without evidence of infection or other identifiable causes, which helps distinguish IC from urinary tract infections or other bladder conditions. Diagnosing interstitial cystitis involves ruling out other issues like infections, bladder cancer, or endometriosis. Doctors typically perform a detailed medical history, physical exam, urine tests, and sometimes procedures like cystoscopy to look inside the bladder. Since there is no single test for IC, diagnosis relies on symptoms and the absence of other explanations. Most people affected are women over 30, but men and younger individuals can also develop the condition. While interstitial cystitis is not inherited, having a family history of bladder problems might slightly increase risk. It often coexists with other chronic pain conditions, such as fibromyalgia or irritable bowel syndrome. From a bladder health perspective, understanding interstitial cystitis is important because its symptoms can resemble more serious conditions, including bladder cancer. For example, blood in the urine can occur in both conditions. However, unlike bladder cancer, IC does not involve malignant growths and does not increase the risk of developing cancer. Treatment focuses on managing symptoms through lifestyle changes, physical therapy, medications, and sometimes procedures to improve bladder function. Because each person's experience is unique, working closely with healthcare providers is essential to find the most effective approach. In summary, the intense pelvic pain in interstitial cystitis likely results from a combination of a damaged bladder lining, nerve sensitization, immune system involvement, and muscle or nerve abnormalities. While the exact cause remains under investigation, current understanding emphasizes that it is a complex condition with multiple contributing factors. If you experience ongoing pelvic pain or urinary issues, it's important to seek medical advice for an accurate diagnosis and personalized treatment plan. Remember, managing symptoms and maintaining bladder health is a priority, and ongoing research continues to improve our understanding of this challenging condition.